Okay, so I finished up round 2. I do about 70% round 1, and about a third of what I do is round 2. And what I like to do with round 2 is add some volume, but it's also going to be super important to change the shape. That's really most frequently why patients come to see me. So here's a really good, kind of typical result and sort of similar problems that I see. And that is patients tend to be a little square up top and then a little bit flat in here. This is a very standard typical case. And so what we did here is establish the Ogee with the lipo here. So I've got a really nice round shape. This is an area that is just so key, so vital, so important to liposuction, because this is really the most important part where the rounding starts. And that's really what establishes that first Ogee. Then the second part that we do is put fat in here, and so I'm getting more hip. Not everyone is able to get as much hip as some patients, because it just depends on how this tissue here will expand. And in some patients it's very difficult because it's like trying to expand a leather belt. And she's kind of in between. I probably would have wanted to give her a little bit more hip if I could, but it's very tight and I just can't put any more fat into that area. But she has a really pretty round shape. The other thing I really like about her BBL is her point of projection, the maximal point of projection. You hear me talk about this with breast, where the breast is most projecting. We like that to be at the nipple and a little bit more volume below the nipple. Here, I managed to kind of move her projection point down a little bit. So now she's projecting right here, which really fits nicely with this hip. This is kind of where I try to get the hip to come out the most. And so I think it looks really pretty where you get this point of maximal projection being in line with this point of maximal projection. And so that's what gives you that really nice kind of spheric, global kind of shape. And so I think she ended up being really pretty and blended this into her leg. And I'm going to show you an overhead shot so you can see kind of what I'm talking about with the changes in kind of the squareness here and the roundness here. All right, so here we are. We're comparing the before, and here she is after her round 2. Just if you look at this line right here, I mean, look at this really pretty line that comes down into her leg compared to, up here where it's really a lot more of this kind of flat square shape. Really nice and pretty, really like the shape. So that's the typical round 2 square to round BBL.